Hello, I'm Dr. Basil Considine. I'm here from the ACU Online Writing Center, and today we're going to be talking about a particular sort of case study analysis where you're using a special set of criteria or factors as a way of shaping your case study analysis. We're specifically going to be talking about an assignment that deals with case study analysis and the social determinants of health. If you're new to the ACU Online Writing Center, we're happy to see you. We work with students at ACU Online's programs free of charge. You can attend webinars such as this, browse our extensive archive of recordings and tutorials. We have paper templates that we've developed to help simplify and make more accessible some of the formatting and criteria for APA style. We also do consultations, short things by email, more extended feedback on papers through asynchronous and real-time appointments. For an asynchronous appointment, you would schedule a time. By the time that rolls around, upload a copy for paper and any special requests for comments, and then we'll send you feedback generally within 24 hours of the scheduled time. If it's on a Monday and the paper is due later that day, we'll get it to you faster. If it's a major holiday weekend, it might take a little bit more time. Real-time appointments are just what it sounds like. You schedule a time and select either phone or Zoom, depending on whether you want to have screen sharing involved or not. And then by that time rolls around, you need to send us a copy of your paper and then either take a phone call or join our Zoom session, depending on what you picked. All right, let us talk a little bit about this webinar, because this is part of a family of webinars, and because we have so many for different programs, if you go to our Writing Webinars page here and scroll down to the tabbed guide, you can select your program and you'll see a sorted list, sorted by course and then by week within the course, of every time that we have for that particular program. So for example, for nursing, we've got stuff that will start as early as the 600 courses and march our way on through towards the final DMP project. You'll be seeing me refer to our APA course paper template later. We have a YouTube channel for watching our videos on the go, and we also have a blog where we explore various writing related topics. All right, so let's go ahead and just take stock of what we're planning to do today. We're going to talk about the principles of case study analysis, and then from that, look at the Nursing 716 assignment that we've chosen for today, this Social Determinants of Health case study. And then we'll talk about how to translate these two different things into outlining and drafting your paper. So let's start with case study analysis. Now, this is something that we've explored in a variety of different webinars, so if you feel that you want to get some additional experience with this topic or understanding the different things you can do, then we have a family of webinars here. And they're more than just these three, but this is a good place to start if you are new to the topic, or if you feel you would benefit from some review. But I think it's always helpful to start with the question of what are the case studies being used for? Is it something that's being used to generate ideas, perhaps? Or to have the people who are reading and studying it gain an understanding of the subject? Perhaps to isolate some details between different instances or real-life events, and to condense it so that they're just getting the details that facilitate a comparison? Is it something being used potentially to dilute bias? It's always a question when you're writing a case study. What details do you include and what do you take out? And understanding how we are biased, or just when we are aware of that, taking it out, is a way of screening the information. For example, if you feel that you might have a bias about particular geography or area, you can still discuss those events, but when you're creating, or someone is creating a case study for you, to take those out so it's not a complicating factor. And then once you see what you would do devoid of that, then you can introduce these other factors and say, oh, okay, well, I understand what I do in the abstract, and here's what I will do or won't do differently in this more specific setting later. So they have a lot of pedagogical purpose there. They're also excellent for illustrating theories, concepts, and for testing out guidelines, seeing how you would apply them to real-world or real-world type situations. They're what we might call a natural or real case study, and also what we might call real-world type or artificial case study where you're creating something just for pedagogical purposes. You might also ask the question, what is the purpose of case study analysis? So if we're previously asking what is a case study for, now we're asking, why are you looking at it? What are the things that you are looking to do in this? And sometimes that's going to be role-playing decision processes. Oh, you are a manager of X, or you are a nurse on a ward when someone presents with this. It's also a great way of identifying phenomenon or patterns of behavior that are important to you for some reason. Also good for understanding or explaining complex phenomena in a natural or real-world setting. And for generating generalizable conclusions. These are things that you can apply to other areas. And before you start writing, there are a couple questions that I recommend that you ask yourself. How are you using this? What do you need to tell the reader, and which hinges a lot on who that reader is. What do you need to tell the reader about why you're using a case study? And what is the lens or point of view that you are using to interpret this? Now, in this particular case, you can guess from the name of the assignment that it has something to do with the social determinants of health. Great. Some assignments are that straightforward. Some are more guided and you need to tease it out a little bit more. Now, as for the case study itself, when you're referring to it in your paper, there's this question of basically, how do you refer to it? How do you cite it? And it's a simple question. Is it published? Meaning someone can access it? If that's so, then you treat it like any other source in APA style. You cite it and reference it. If it's not, if it's something that's only accessible through the class site, for example, then you can refer to it in text, but you wouldn't include parenthetical citations or you wouldn't have an entry in your references list. That's it. So if you were describing this, something that is only mentioned in the assignment and not published somewhere else, you might say, okay, in the Great Lake food case study, or in case 3.1, Dr. Wood is, etc., etc. So let's take a look at the assignment instructions now. Now this is coming from the Healthcare Finance and Clinical Practice course. And that's a guide of some of the themes that might be important here. So there's a case study we need to review, and using information from the week's readings and other resources, we need to write up a 2 to 3 page summary responding to case study questions. It should all be in APA format with cited sources, cover page, and reference page. Okay, no problem there. And we have a little background information, name of the patient, their age, their insurance eligibility, their home setting, some stuff about their medical history. And we have the narrative here. So Mr. Wanyoni presented to the emergency department with shortness of breath and generalized weakness after falling on the sidewalk in front of his apartment. During his hospitalization, he was found to be in an acute exacerbation of heart failure. His workup shows reduced ejection fraction and increased left ventricular size. He also presented with weakness and malnutrition. On exam, he was anxious and answered questions intermittently. During hospitalization, it was discovered that Mr. Wanyoni is non-English speaking with Swahili as his primary language. He is illiterate in English and Swahili. Due to his PTSD and uncontrolled schizophrenia, he has a long history of distrust of the medical system. More recently, he was withdrawn from his community due to distrust of strangers and those he knows. He has not been eating or taking his medications. When asked, he states he thinks he may be poisoned by his medications. He is fearful to go to the grocery store and tries to limit these visits to once per month. At discharge, he'll be sent back to his home setting, endorses that he would like to get better, and reluctantly accepts help at discharge from hospital. Some history. He immigrated to the U.S. in 1982 due to violence in his home country. Does not have family in the U.S. and has lived alone for 34 years. In the last year, he has had no emergency visits, no inpatient stays, and 1 primary care visit. Medication fill history is sporadic. Is assigned to a public county clinic for primary care. It's also established with a psychiatrist at a local mental health clinic. but he cannot remember who he sees or the last time he was in clinic. So a lot of stuff going on here. And note that the assignment instructions here include a reference. So if we're looking back at the previous question for, is it formally published and accessible to the public? Well, through the criteria of APA style, this has been published online. You would cite and reference it like normal sources. So author date citations. In this case, it doesn't have a listed author, so you assign corporate authorship, so the organization whose website this is listed as the author. And we have a series of 4 questions to answer here. First, reflecting on this week's readings and information, what are 4 social determinants of health issues noted in the case study? And what interventions would you consider for this individual to reduce his risk for hospitalization? Third, what health risks or future health or psychosocial issues may occur as a result of current status? Considering the programs presented today or available in your setting, which risk factors are modifiable for this individual? And if we go through and look at the rubric here and compare it to these instructions, we'll find that the first item corresponds directly to the first question. The second one is not as clear. It says paper evaluates and provides financial and social recommendations. And so if we look at the question, what interventions would you consider for this individual to reduce his risk for hospitalization? We see, oh, that's a suggestion for a direction to go in. And then the third and fourth lines, the third line aligns pretty closely with the third one. And considering what's presented today and what risk factors are modifiable, that does align pretty much with the third one. So we have guidance here from the rubric that you should be talking in here about financial and social recommendations, some of which will be in number 2, some of which will be in number 4. Alright, and besides that, a reminder, 2 to 3 pages, APA style, basic writing standards, so make sure to proofread and spell check and grammar check your work. So how would you go about outlining and drafting this? Now, if we look at this is going to be a fairly compact paper, just 2 to 3 pages, not counting the cover page or the references page. So if we're starting to outline this, well, of course we want to have an introduction to what you're talking about. And then because it's clear that the rubric is outlining these 4 different areas of content that will be graded, combined in the first 3 lines there, it'd be good to mark clearly that you're doing that. So when you are organizing your paper after that introduction, put an AP level heading indicating that you are answering one of these questions here. So it's good. Oh, there's my answer to that. Now, when you are doing that, you also want to follow, of course, with an answer to the question. And here's a suggested way for planning that out. First, give a 1-sentence response to the question, a direct response. You can always follow up, and should follow up with more detail, but if you start out with that response, and like, okay, all right, that makes sense, that's a good place. Now, once you've done that, the 1-sentence response is essentially your topic sentence laying out. Here's my claim, here's my brief response to the question. And then you want to unpack it. Give supporting evidence, argumentation, analyze it, synthesize it, tell us, what does this mean put together? And all of that together, you should have a paragraph that's going to be somewhere around 5 to 7 sentences in length for each of your answers. And then, space permitting, after you've answered all 4 prompts, give us a short conclusion at the end that ties into the goals, that says, okay, beyond answering these questions, here's how it matters versus what we are doing in this class. Now, a couple reminders. Do ask yourself, what is the purpose of this case study analysis? Why are you doing it? And for that, I'm going to give you a hint. Take a look at the week 1 module instructions. See at the bottom, we have 2 things: to differentiate between types of healthcare financing options available for patients and populations, and to determine the relationship between social determinants of health and its effect on healthcare financing. Well, if we go back and look at the assignment instructions here, after this general overview, we have the introduction to the patient. And here we have a couple hints about what's going on. It's eligible both for Medicare, which is age-based, and Medicaid, which is income-based. Also living in a low-income apartment. And then you have the rest of the medical history, none of which makes the other things easier, but this suggests some directions that you might be going in with this assignment. Certainly there are some challenges, and based on your geography you might have access to different resources, but as you're answering these case study questions, keep in mind, how does this matter in the aggregate? How does it influence the whole package to what you would do, and how this illustrates the importance of the social determinants of health, and money in particular. Money or socioeconomic status and other ways of dividing it are hugely important, and as you tease out connections there, you'll be able to look at, say, okay, here's something that I see as important that I can talk about in my conclusion. So take notes on that as you develop your outline, and you will then have many things you can draw on, probably more than you will have space for, and then you're in the happy place of choosing the strongest or most relevant or most pressing things to discuss and to make those connections. Now again, because that case study is published, you do want to cite it. Okay, author, Institute for Healthcare Improvement, date. Well, it actually doesn't have a date in the document. So you use N period D period, stands for the Latin phrase non datum, which just essentially means no date, not dated. And we capitalize the title in sentence case, followed by the URL, and there you have it. Alright, now make sure to use our AP course paper template to do a lot of the formatting for you, but if you go back and you start laying things out using this format, okay, an introduction at the beginning, conclusion paragraph at the end, making sure that you answer each question in brief and then expanding that so a full paragraph response, then you'll end up right around that 2 to 3 page length. And you'll have introduced what you're going to be doing, and if you're wondering what do I say besides, oh, I'm writing about this patient case study, well, tell us what the main areas are, which will be, those questions you're answering, or the themes behind the questions. After that outline, okay, a heading, then that tells us which question you're answering or which subject you're speaking to. Then give us the answer in short, and then in longer form. Move on to the next one, and when you're all done, a conclusion. And if you know, because you've mapped this out, what all those things are going to be, it'll be very easy and fast when you're doing the reading to align and say, oh, I can cite this source here in support of this. So and so said to do that, so that's why I'm doing that, and so on and so forth. So if you have any questions, feel free to send us an email at onlinewritingcenter@acu.edu. You can sign up for an appointment online, visit the Online Writing Center to see the recordings for this and other materials, to download templates, read our blog, and more. And with that, if you have any questions, send us an email, and we look forward to catching you at another webinar.